It's not nearly as bad as it was last year, but the number of Iowans in the hospital with COVID-19 has been on the rise for weeks. 2 Iowa doctors are here offering their ideas on whether money or public shaming the unwilling to get vaccinated could actually change their minds. Plus, find out the person Senator Chuck Grassley told me that you will not see him leading around at the Iowa State Fair this year. And in the Insider's Quick Six, lining up behind a candidate.
From your local election headquarters, this is the Insiders with Dave Price.
Iowa hospital officials say they're getting calls from Missouri asking if there is room for COVID-19 patients in this state. Now, more than 200 people are already hospitalized in Iowa right now with COVID-19, but it was more than 7 times that many last November. That was before Iowans could get vaccinated. Well, nearly 1 in 3 Iowa adults still has not received a COVID-19 vaccination. 2 Iowa doctors told me they want vaccine skeptics, the hesitant, or the procrastinators to talk to them.
Really what we're encouraging folks to do is kind of look at the big picture, look at the trends nationally, look at the statistics of vaccinated and unvaccinated, because if you pick and choose those outliers, you're going to be able to find support for lots of different viewpoints, and what we're asking people to do is take a broader perspective.
Would you vaccinate your children, no matter the age?
I would vaccinate my kids. I have a 13-year-old and a 10-year-old and an 8-year-old and a 6-year-old.
So one is eligible now.
One is eligible. He just became eligible, so yeah, a little bit ago.
And you have no concern about the little ones even?
I would say...
And we're not to that stage yet.
Yeah, I would say I don't have any reason to be concerned. There's some unknown, right? And so with anything where there's a little bit of unknown, you can start to ask questions. But if I look at things from what's the evidence, and that's what I'm supposed to do as a physician, that's what I'm trained to do, there isn't any evidence to say that it's bad or long-term effects or scary for any particular reason at all.
Parents and school board members, superintendents are all looking ahead for those who follow traditional school calendars, looking at what to do starting this fall. Now we're just a couple of weeks away. So what is the best path forward? What do you recommend for them to do, for parents to do to protect their kids, since most of the kids are not eligible for vaccination yet?
Well, first, for those that are eligible for vaccination, it's definitely something to encourage your kids to get. Talk to your pediatrician if you have questions. Talk to a knowledgeable source in the healthcare field so that they're aware, and knowing what they've seen the rest of the pediatric population that's been vaccinated, they can give you the real honest truth, because it takes 2 weeks from the vaccination for you to have that immunity. And so with school coming up, at the end of August, if you get your first dose now, that'll at least be effective before school starts. For those that are, outside of that age range in the pediatric population, encouraging, healthy, masking in indoor settings in close quarters. I know schools aren't allowed to have mask mandates, but it's definitely something you should have a serious discussion with your children about taking the best course of action. I know I've done the same. I have a nephew starting kindergarten in just a few weeks, and that has been probably weekly conversation I've had with my brother-in-law and sister in regards to what to do best for him.
There are those who point to numerous things they find on the internet about whether masks are effective. You both wear them for certain aspects of your job. Do they work or do they not work?
Well, I'll just give you an example. We've been treating patients and wearing masks in the hospital setting for over a year now, in close contact with patients who have COVID, some of whom we know have COVID, and so you can be extra careful with everything. Some of whom we have no idea that they have COVID until we find out on a test. And those folks are still infectious and can still transmit the disease. And we see in our system pretty much nobody who gets COVID at work. The vast majority of healthcare workers in our system who acquire COVID acquire it from the community. And so to me, that's an indication that masks are effective. When I can go around and interact with COVID patients, get right up next to them, listen to their heart and lungs. They have a mask on, I have a mask on, I've been vaccinated, and I'm not getting COVID.
So would you say kids should wear masks in class when they go back to school?
If they haven't been vaccinated, the recommendations are they should wear a mask.
And staff as well?
And same for staff.
What about regardless of vaccination status?
Well, regardless of vaccination status, if you've been vaccinated, I don't know that the CDC has strong recommendations either way, but if you've not been vaccinated, they absolutely recommend that you wear a mask.
Aren't they stressing it that if you're in the counties with the highest prevalence of the spread?
Yes, yeah. So there's variation based on that, based on the positivity rate, yeah.
And right now that includes much of the state of Iowa. So yeah, if you have been vaccinated, the recommendation in those high percentage positive counties is to wear the mask indoors, and that would include our schools and our teachers and teachers' aides. And I think some people worry that that's going back on, a promise of if you get vaccinated, you won't have to wear a mask. I think if we're only getting vaccinated to not wear a mask, our intent for why we got vaccinated in the first place might be a little limited, and we should look at the bigger picture of really trying to help not only me individually, but those around me, those we're teaching, those that aren't able to get that vaccine for one reason or another. You never know, even if they're eligible, if somebody has a condition where they cannot get a vaccine, who you may be helping by following the guidelines.
But the biggest benefit is of wearing a mask is to the person who has not been vaccinated. So, there's some self-interest there, and that's okay. I think to recognize that is to recognize a lot of the facts of the situation.
How are you both dealing with the patients, but maybe more so the family members of those who either don't believe COVID is a thing or don't believe in vaccinations, whatever it may be? How are you dealing with that? Because you all can frequently deal with people in pretty tense, emotional, life or death situations. So how are you managing those conversations when you have that wall that's already there?
So what I've noticed is that folks have a lot of questions, and so they've gone to locations and sources to get information, and sometimes it's not been good information. So that's typically where I will start, is to kind of ask them what they do know, and then there's that wall that starts to break down as we start to have a discussion. And you can have that discussion in a really reasonable way. And even folks who may have some beliefs that comes from those misinformation, as you start to talk to them, there's a lot of sensible Iowans out there. And when you start to get into the details and have a rational, thoughtful conversation, I've been impressed with their response. And that's why I've said from the beginning of this, if you have questions, go to a reliable source, go to a trusted source, go to your primary care provider. You could schedule an appointment to talk just about that.
Yeah, I think one thing I try to be mindful of is if somebody's very reactive or very upset or very up in arms about this discussion, is that there's probably a healthy amount of fear behind that. And that's okay, and that's understandable. And let's try to figure out what that fear is. And if you've received information that's not true, what can we do better to give you, the facts that as we know them from a medical professional? And I think that also involves talking about some of the cases we've seen, we can't share information, but sharing those heart-shattering moments of, grandma or grandpa having to say goodbye through a window in our intensive care unit because we couldn't allow visitors. That has happened both pre and post-vaccination. We've had young people, and this past weekend alone, the number of cases in their late 30s to mid 50s that were admitted with COVID and were unvaccinated is going up. Some of those are in the intensive care unit already. A few might worsen to that point. I recall even a young guy with really no major medical problems that ended up with his COVID. He had to be put on the lung transplant list. And the number of those cases is increasing the longer the pandemic goes on. So it's not just a one-off case like, oh, you highlighted the worst in that one person. We're seeing more and more of those stories. And I think as we look at social media, for disinformation, I see it from healthcare agencies and other leaders in the field, and the same stories are coming up. Young people sick, young people that wished they got the vaccine before it was too late, people with 5 children passing away from COVID when they didn't necessarily need to. And so if we can do anything to, play at that personal level with our patients and help them see really how tragic it could be, I think we can maybe move the needle in some patients.
But how do you move those who are frustrated with, to your point earlier, when they heard before, if we wear the mask, this thing's going to go away and we can resume our normal lives. And then when vaccines were available, the vaccines were going to enable us to do that. Now they're seeing this resurgent, probably led by the Delta variant, but now there's talk about mask mandates in certain places and it's just not working. So their fear is that the goalposts keep getting moved here.
Yeah, well, I would say the goalposts haven't moved. All the messaging has been the same for the past year, but the expectations about the time to get there is probably different.
Because of the politics that get in on this?
Well, that certainly influences things because it influences people's personal behavior, but I think some of the things that we've talked about earlier with regards to herd immunity and how you acquire that, that hasn't really changed. It's just we haven't gotten there at the timing that we anticipated. And so, when you talk about a goalpost, you can talk about a time frame, or you can talk about a percentage of the population that's been vaccinated. And really, if you were going to make a goalpost that is kind of the finish line, you should be talking about percentage of the population that's vaccinated.
What are the cases that stick out in your mind, the hard ones you've seen?
Yeah, so I've seen some of the cases that he's talking about where folks are middle-aged and they're very, very, very sick, and it's impressive. As an ER physician, I see a lot of really sick people, and I didn't, over the last year, I've never seen anything like it, and I've been doing this for 12 years now. What I think is really interesting lately is Dr. Stevani mentioned that there are folks who are in their 20s, 30s, 40s, 50s, and then I also see those patients who are coming into the hospital and those who are going out of the hospital and being discharged from the emergency department. They're sick with COVID, but they don't need to be in the hospital yet. I've noticed that I can see an 88-year-old who's been vaccinated and they have COVID and they're going home, and I can see a 28-year-old who hasn't been vaccinated who has COVID who may or may not be going home because they're sicker than the 88-year-old.
Yeah, I think additionally, for me, it's always the folks you don't anticipate getting sick that stand out in your mind. So it's the young patient, it's the patient that maybe is 50 years old but has really minimal medical history, and you see them for the first couple of days in their hospital stay, and maybe they're doing okay, maybe they got a little better, but then all of a sudden in a 24-hour time frame, they flip the other way, and they are now on intense amounts of oxygen, they're gasping to breathe, and we've maxed out what known therapeutic regimens we can do to help them, and the next phase, if they get worse, is that critical care transfer, intubation, putting them on the ventilator. And it's the saddest thing to have to say to them, or to call their family member who may not be able to be at the bedside and have to have that discussion over the phone that you're sending their husband or wife to the intensive care unit and you don't know how it'll turn out. So those ones just sting. We're not immune from grieving for our patients as healthcare providers. There's a lot of us that have done a lot of grieving in the past 18 months.
I wonder if we could close with what your suggestion is to increase the vaccination rate. We've seen in some counties have done financial incentives of some sort. Some states have done that. Is money a way to push people over? Is it more just a conversation of sitting down with your local doctor? What's going to bump this up?
Yeah, I don't know that finances or public shaming are the best route to go. As a provider who has a lot of individual conversations with folks, I've seen that to be quite effective. It's really hard to sit down and talk with somebody who cares. So if I'm sitting down and taking care of you and you're really sick and I'm trying to care for you, and you can see that I care for you and I'm doing everything I can to help you get better, and we have a really intimate conversation about how that is going to work and what we can do, and part of that is about a vaccination. That's where I've seen folks have a change of heart. And it's sometimes an emotional decision more than it is a rational and logical decision, and that's just a part of human nature, is those feelings come into play with those kinds of decisions. And so not just laying out facts all the time, which is important, but appealing to kind of the heart of that person and where they're coming from. And then after that conversation in a trusted environment, I've seen a lot of folks have a change of heart. So that's a lot of work, but I also think that that's where you get the most kind of decisions go from one end of the spectrum to the other end of the spectrum.
Definitely personal relationships and one-on-one discussions are going to go a lot further. You are more likely, people are more likely to listen to their closest confidant, their spouse, their best friend, their grandparents, even their kids, and adult children will speak to their parents and talk about the severity, and that's where the needle can get moved, because that's who you trust the most.
All right, up next, U.S. Senator Chuck Grassley on the member of Congress he will not escort around the Iowa State Fair.